Okay, I want to welcome you all to the webinar presentation of the AMA dr2dr Secure Messaging System. I'm Michael McDermott. I'm the Project Manager for Secure Messaging, and I'm going to be doing this presentation along with Brendan Blank, the Vice President for MicroQuest. Today what we're going to do is give you an understanding of where we are in the project and what's happening on secure messaging and why the AMA is involved. So what we'll cover off is the rationale for the secure messaging system, the benefits that we see for patients and providers and the health systems as a whole, how we see physicians actually using the doctor-to-doctor system. We'll talk about privacy and security because we know it's an important topic for people. We'll cover off long-term vision for secure messaging, where we see this going in the province, and then we'll do the demonstration of the system. So Brendan will come up and give you a tour of the system, and then we'll talk about development and rollout, where we are right now. And we'll talk about how sections and physicians can become more involved. So what is secure messaging? I guess we'll start by saying it's a way to securely send information back and forth between providers about patient care. The big difference between secure messaging and secure email is that on a secure messaging system, everything's coming into a single server. And I'll talk a bit about that in a second. The other thing about secure messaging is that it's compliant with your industry standards. So the Health Information Act here in Alberta, FOIP, PIPEDA, PIPA, those types of things. So why are we doing this, and why are we moving forward with secure messaging? I guess the biggest reason is that we know right now physicians are limited in their ability to actually send information back and forth in a secure manner. So if you're providing patient care, there's really no good way to send information from point A to point B in our health system today. So this is a problem that's been recognized by a lot of groups. So the Office of the Information and Privacy Commissioners recognized it, the College of Physicians and Surgeons, the government, Alberta Health, and it certainly has been recognized by the AMA and its members. So a good reason to get moving on it. The other reason we'll just mention is that we know there are gaps in the system right now. The best example we can probably provide is from the Health Quality Council report of December 19th. This is the price report, and if you've read the report, you know there's a lot of issues with care, continuity of care gaps that could be addressed by something like a secure messaging system. So another good reason to get involved. And finally, we all know the difference that email's made in the business world. So we know what's happened when the transformation that's happened when we went from going from memos to email, and the same change in care we can expect when we start moving that out in the healthcare system in Alberta. So it's going to enable new forms of care and communication and a lot more opportunities for people to work. Okay, so I just want to talk about the difference between secure messaging and secure email in a little more detail. Again, secure messaging, all of the data resides on a central server, so it's a little bit different from email. With email, you've got your email system, you've got other email systems that are out there you're trying to communicate with. All of those systems need to be secured. You've usually got clients on the desktop that also need to be secured, so there's a lot of moving parts in there, a lot of pieces that actually have to be knitted together to make it work. With secure messaging, everybody logs onto the same server, so we can guarantee that the information is kept in one area, that it's safe, and then when it's transported, it's encrypted properly so that we don't have any issues on it. The other nice thing about secure messaging is that we can have a much easier time dealing with authentication. So we can ensure that whoever gets on the system is who they say they are. So for example, for physicians today, the AMA will be authenticating them before it goes off to the doctor so that we know that the people getting on are appropriate, and then the physicians can actually authenticate and bring on their staff. We can also do this without putting a lot of clients or software on the desktop. It's basically a web-based system, so you can get at it anywhere, and you don't have to worry about the information being secured. Okay, why is the AMA involved? Well, first and foremost, we know that there is a real need right now for a simple tool to send patient information back and forth between healthcare providers. This has been brought up many times by physicians, and it's also been brought forward in the Representative Forum meeting in spring 2014, where the AMA was actually told to engage in this activity. So these are the physicians actually speaking on where it needs to go. The other thing is we actually strongly believe that there's good value to come out of this, both for the patient, the provider, and the health system. And finally, it aligns well with the business goals for the AMA. What are the goals for secure messaging? We have several goals for it, but the three primary ones that I want to speak about are listed up on the slide here. So first and foremost, we want to provide that seamless and timely flow of medical information back and forth between care providers. So this is just getting the whole information flow in the system working faster than it does today. The second reason is actually to reduce wait times for access. We know that there's lags and gaps in the system that come about from using fax machines and phones. So taking those out of the system will help speed up the care processes and wait time processes. And the third one, the one that gets physicians probably most excited, is coordination of care and continuity of care. There's a real opportunity here to improve both as we use the system to coordinate care. What is the secure messaging solution? Well, the main secure messaging solution is builds on the dr2dr application developed by MicroQuest. We've been in partnership with them for a while now. One of the benefits of that partnership is our physician engagement committee has been working with MicroQuest to update the product and ensure that it provides good value to physicians when it actually rolls out. So I'm pleased to say that the feedback from the doctors has been incorporated into the system. We have a new version that's up and ready to go, and I think physicians are going to be quite happy with the product when it rolls out. Our long-term plans also include other providers, and I just want to make this clear because it's not only physicians that can benefit from secure messaging, it's the health system as a whole. So we've had talks with pharmacists, we've had talks with other care providers, and ultimately we have to get them on board and using a secure messaging product as well. So why should you use it? There's a number of reasons to use dr2dr. I'm not going to go through everything on the slide deck here, but I'll talk about it in general. First and foremost is protection of privacy and protection of reducing risk. So this is going to help make sure that the patient information is protected while it flows in the system, and it's going to help reduce risk for the provider who's actually sending the information back and forth. There's no opportunity here to send information insecurely to anybody else in the system. The other reason that is going to be important here is collaboration. One of the things you can't do with a fax machine is collaborate with other individuals. With secure messaging, you can get on there, you can have several people involved in the conversation, you can have it go back and forth very, very quickly to manage patient care. So this is a real improvement over what we've got currently. The third one is improved workflow. So you're going to be able to manage workflow in an easier fashion, work with individuals, move information around faster than you can with the fax or the phone. And finally, it's just that security. It's being able to take things like off-the-record conversations and move them into a place where they're actually on the record and included in the patient care chart. A couple of other key reasons why you want to use this. We've been working diligently on a better address book for physicians and clinics. So this is something that's come out loud and clear from our physician advisory committee. Physicians need to know who they're dealing with, and that means knowing what their specialty is, what the physician does, what they don't do, and also it's important to know whether they're actually in the clinic or not in the clinic. So no more sending faxes off to groups of people that aren't actually looking at the faxes. The system will actually tell you that people are in or out, and Brandon will talk a little bit more at this when we get into the demonstration. The other thing I'll mention is that there is no spam on the system. We know that a lot of people have other email systems that they use or messaging systems that they use. We know that they get a lot of other information flow in there. This system is purely designed to be for clinical care. It's a professional account that people are getting. So you're getting that information. You're not getting all the other stuff that would remove your attention away from patient care. Regarding costs, the system does have a cost, and we know that offsetting that cost is important for people. So we're happy to say that right now in Alberta we have 2 new e-consult fee codes that are available. If you're using the dr2dr system, you'll be able to take advantage of those fee codes. One of the fee codes is for the person that's responding to an e-consult request. That's already in operation right now. Come April 1st, there is going to be a new e-consult code for the person that's actually doing the requesting piece of the puzzle. And between the two, you will be able to cover off both sides of that equation and offset the cost for the system. And I'll talk a little more about what those codes are in a bit. And the last thing I just want to mention is that we do know that dr2dr is going to help shrink the overhead costs associated with faxing and telephone. And that's not just the cost for the actual hardware or the toner or the paper. More importantly, it's the cost that surround the people that you have in the clinic that are managing the workflow around it. So lots of costs associated with that, lots of ability to reduce that with dr2dr. How do we think it's going to be used? Well, there's lots of different ways, and we're always interested to hear how physicians are using it. Lots of different ideas have come up. But the three primary ones that we see are the rapid exchange of clinical information back and forth. So again, just getting that information flow back and forth between clinics without using the fax machine. Moving forward with clinical advice quickly and efficiently. And again, it's the ability to get somebody on the system or several people on the systems in a conversation and have that back and forth. You can't do that with a fax machine right now, so this is new functionality. And finally, it's the bread and butter piece of facilitating the electronic consultation referral. So it's about allowing staff to send the information back and forth between clinics without using the fax machine. So again, like the picture says, we're hoping that people are going to axe the fax, start moving away from the phone, and start using doctor-to-doctor as a more modern way of messaging people. So privacy and security is important to folks, and we just want to let you know that it's important to us as well. So we're spending quite a bit of time and effort to make sure that this part is addressed. There's several features of the program I just want to mention that are going to be important to folks. The first one is that the message generator and the authorized receiver are the only people that have access to the message. So this is important because for privacy purposes. First, the AMA doesn't have access, Alberta Health doesn't have access, AHS doesn't have access. It's only the people that are sending the messages back and forth. The second thing I want to mention is that full audit details are available. The system has been designed from the ground up to track all this information. This isn't an add-on. It'll track all of the dates that people are logging into the system, that you're sending messages or receiving messages or working on messages. That way, if there's an issue or we need to go back to the records, all that information is available. One of the other nice things that we're doing is that we're heading out to get a third-party security audit for doctor-to-doctor. What this means is that we're engaging a specialized security firm to come in and make sure that the controls in place and the system design are robust enough to make sure that nothing's going to happen with the information. So, in other words, the system's not going to get hacked, or there's no holes or problems that have to be addressed. So this is important for folks. This is something that other systems probably aren't doing, and we're very excited to say that we are taking part in. The last part I'll mention is authentication. So we have physicians that are going to be authenticated, the method I mentioned before, which is having the AMA authenticate them and then having them bring their users on and vouch for the users coming onto the system. The other thing with that is two-factor authentication. One of the nice things about doctor-to-doctor is that it's a little simpler to use than other applications that are out there. We support Google Authenticator, SMS or text codes to your cell phone, and email. So Google Authenticator, if you're not familiar with it, is just a little application that sits on your cell phone. It generates an ID number, you enter that ID into the system, and it logs you on. It's basically a soft fob. So the nice thing is you don't have to carry around other pieces of hardware on the system. You just use these pieces and you log on. The one that gets physicians most excited is actually the text messaging or SMS code. The nice thing about that is when you log onto the system, doctor-to-doctor will send you a text message to your phone. The nice thing about your smartphones today is you normally don't have to log into them. You can see the text message right on the front screen. You enter that number and in you go. So EMR integration is important to people. We understand that it's important to get this integrated with the EMR systems, and we're pleased to say that we have a long-term strategy and a short-term strategy on this. In the short term, the doctor-to-doctor system actually has a proprietary application programming interface which allows it to interface with other EMRs. So what this allows it to do is it puts additional buttons in the EMR system that allow you to send information to doctor, and it has additional buttons in doctor which can send that information back to your EMR system. So it's a seamless flow of information back and forth. Right now, the one system that's integrated is HealthQuest EMR, which is also from MicroQuest, but we're in active conversations with other vendors in the province to get them up and on board, and we do have some interest on that, so we're pretty excited about it. In the long term, what we want to have happen is we want to have doctor-to-doctor actually integrated into a larger secure messaging environment for the entire province. The objective would be here so people stay on the system that they're currently using, and you can send a message out of that system and communicate with anybody else in the system. To make that work, we need secure messaging standards, and we need a secure messaging broker solution that would allow the different systems to talk together. So we've started into conversations with folks on that. We've talked to Health, we've talked to the Alberta Health Services as well, and we'll keep working on this for a long-term solution. Again, this isn't something we can set up in 5 minutes. It's going to take us some time to get there, but in the end, it's going to be good for everybody in the health system. So where is this all going? Well, we think it's inevitable that we're going to be moving away from the fax machine. It's basically a dying entity. It's going to be something that's going to be outmoded here in a few years. What we want to see is everybody move to a secure messaging environment faster. To do that, what we're doing is we're encouraging all the physicians to actually axe the fax. So get on board with dr2dr and start moving away from the fax machine. If we can get people committing to turn off the fax for consultation referral purposes in the next 12 months, that's going to help us snowball this to the point where we can get other doctors up and on board and move over quicker rather than slower. So I want to talk a bit about the workflow for dr2dr and how messages actually work. There's 4 main methods of communication in the system, and they all bear a little explanation. So I'm going to explain them here, and then Brendan will talk a bit about them when we actually get into the vendor demonstration. So in the first example is dr2dr messaging. So in here, Dr. Benton is wanting to talk to Dr. Park. He simply sits down, selects Dr. Park's information out of the address book, and starts sending a message off to them. So it's very much like email in that respect. dr2dr supports messaging between any doctors in the system in Alberta right out of the box. The second method of communication is actually clinic-to-clinic messaging. So this is going to be where a lot of the message flow is happening in the system. This is where you have a medical assistant in one clinic that's going to be packaging information and sending it over to medical assistants in another clinic. Those medical assistants are going to be monitoring the inbox for the clinic, and they're going to be dealing with that information. And their job's going to be moving that information around and attaching it up to physicians as appropriate. So if there's 50 requests for referral coming into the clinic in a given week, Dr. Park might only see a part of those, so the medical assistants will send the ones that are relevant to him over to him and attach them up. The other ones that are not relevant are not going to be seen by him. So in that way, we're actually buffering physicians from a large portion of the message flow into a clinic. The other 2 ways that communication can happen is staff-to-staff and user-to-user messaging. So staff-to-staff is fairly simple. dr2dr supports anybody in the clinic communicating with anybody else in the clinic just for the workflow purposes. User-to-user messaging is a little bit different, so this bears a little more explanation. In user-to-user messaging, if we have a person in one clinic that wants to talk directly to a person in the other clinic, they require permission to make that part happen. The reason for this is we want to curtail workflow so that most of it flows through the clinic-to-clinic bucket. But if we want to have a relationship between 2 individuals, that's certainly supportable by the system. So once permission is granted, similar to a Facebook request or a LinkedIn request, then those 2 users can communicate directly. So in this example, Kim might be the office manager in one clinic and want to talk to the office manager directly, and to John, the other office manager in Apex. She would ask permission from John. John would grant it. Then the 2 can communicate back and forth without using the clinic mailbox. So that concludes the first part of the presentation. I'm going to turn over to Brandon for the software demonstration.
Great, and thank you. I'm going to give you guys a quick demonstration of the dr2dr system. So to start off, we're on the dr2dr landing page, which has a fair bit of standard marketing information on it. If you scroll down in that page, there actually is a newsletter if you're interested in signing up. Just enter your first name, last name, and email address, and we usually send that out every few weeks, so it just keeps you up to date with what's going on with dr2dr. We'll skip that right now and just go ahead and log in. So using one of our developers' accounts, this is Dana. I'm just going to punch in the password. And this one does have 2-factor authentication. Not that you can see my phone, but I've got the Google Authenticator app set up. So I'm just punching in the code that it's currently generating. And here we are into the dr2dr system. So I'm logged in as Dr. Clark Bonner, and this is just an overview of the site itself. Down the left-hand side, we have a list of all the mailboxes that Dr. Bonner is part of. And he has 2. He has his own personal mailbox that's got the little physician icon here. And then he also is a member of the Boardwalk Clinic. So that's the public-facing clinic mailbox that he's part of. Within these mailboxes, we have a list of all the conversations that there are. And then as the conversation is clicked on, the conversation itself shows up in the far right pane, and that's the back and forth between the members of that conversation. The mailboxes themselves have statuses, so you can very quickly find messages in any given state. And this is just really for workflow management, but we have in progress, for example. We have pending, not processed, all those sort of things. And as you click on a message, you can change that status by choosing it up at the top and simply choosing the new status that you want to send that to. So we'll set this one to pending, and off we go. There's an all option as well, just to see all of those messages, and then obviously the message body. Now, within the message, we do have away notifications. So this is much like you would get an autoresponder with an email. You can set an away notification in the doctor-to-doctor system, and if you click on that, it actually gives you information as to why this doctor is away. So in this case, Dr. Christy Cooper is away, and she's not returning until November 10th. So that'll show up even if it's an older conversation that you go back to and the physician is currently away. It does record all that information. To send a message, we simply type in our message and click the send button, and that sends it off. And if somebody's on the other end, they can reply and say, hello. We'll send that message, and we get that conversation coming back in real time. There are read receipts with these messages as well, so I can see that Neil Merritt read this up to this point at 9:42 p.m. or a.m. And Dr. Clark Bonner has read it as well, or he sent that message at 9:42 a.m. There's a complete full audit log history of everything that happens within this conversation. So in addition to just when messages are sent and date and time stamped, we also do keep full track that Dr. Bonner viewed this message on this date and time, from this IP address, this computer, all that kind of stuff. So if ever there is a privacy breach or any sort of concern with privacy or security, we do keep all that information, and we can pull that out and provide that to the applicable parties. So now I'm going to go ahead and start a new conversation, and we do that by clicking the green Start a Conversation button. Now, much like email, we actually have options as to who we're sending this on behalf of. So we can send it from Dr. Clark Bonner, or we can also send it on the Boardwalk Clinic because he's part of both of those. And then in the to field, we can just simply start typing the name that we want to send it to. So let's type in Neil. We get Dr. Neil Merritt popping out. And if we're not sure exactly who we want to send it to, we can click the address book button, and we'll actually get a list of all the clinics, doctors, and users within the system. It defaults to clinics. We can click on one of those and get some more information. So it gives us our standard phone book info, address, city, province, postal code, phone numbers, fax numbers, all that information that's been set in there. And then it also gives us any associated doctors within that clinic. So we can add that clinic to the conversation. And let's move over to the doctor tab. And if I just do a blanket search, I get a full list of the physicians within the system. And you'll see Christy Cooper, she is away. So it's that same away message, but it's right there in the address book search. So if you're looking for somebody, maybe you don't want to send it to her because you know she's away, that all shows up right there. Clicking on her, it does give information on all her specialties, special interests, and any clinics that she is associated with. So all that information is included there, and we'll add her to the conversation as well. We'll just quickly move to the contacts tab. So these are those connections that we've got set up. So I'm connected with Dan Black, Christy Cooper, and Neil Merritt, and their information all shows up in there. And then finally, there's the users tab, and if I search those out, these are all the users within the system. Very similar, we can click on those and get the phone book information. And if there's somebody that I do want to connect with, we can actually request that right here. We'll choose that, we'll hit request, and it sends off a request. So let's go ahead and add these users to the conversation, and they show up here in that to box. We can change the priority of the conversation from normal or urgent. Let's make this an urgent conversation. And then we just simply type in the subject and the body of the conversation, and any information that you want to put in there. We can attach patient demographics as well. If we click the Attach Patient button, we can add new patients to that. If we click that, we simply get a list of all the standard fields that you would collect, PHN, name, address, date of birth, etc. And all that information can get thrown in and populated into the system. We can also use an existing patient. So these are patients that have previously been used in the system, and we do keep track of all those demographics. Let's choose Harry here. Just rather than typing in all those demographics, we'll hit done. And you can see that his demographics are associated with this conversation now. Finally, we can do add attachments. And this is just a standard attachment grab from your computer. I'm going to choose a PDF document, but you could also choose JPEG files, image files, Word documents, movie files, PowerPoint presentations, all that kind of stuff. And we don't really limit it aside from things like executable files, which obviously you don't want to be uploading. Finally, I'm just going to check off require read receipts so I can demonstrate that functionality. And that's much like the read receipts in email. So we'll send that off. And I'll just take a second here to send. And then as the site refreshes, we get the conversation that we just created. So you can see this is the body of the message, welcome to the webinar. There's a link to the attachment, and if we click on that, it'll actually open up in a separate window with the attachment itself. So this is that PDF document. We have the patient's allergies, problems, active medications, and then a quick little letter referring the patient. That all shows up there within the system. Close that off and back to the message. And if any physicians are online, they can actually get a notification of that and reply back, as we will do. So we get that message back, and then Neil can also flag off that he has read this message, which is an explicit read receipt. So we'll check that off, and that pops out that Neil has read this message. And so we know that Neil is part of this, or is online right now, because up here at the top it actually has a green dot beside his name. So that's a visual indicator that he's online. And if we log him out, then he'll actually go to have a red dot as well. So we do know right off the bat if people are currently on the system or not. Now, the other thing that we can do with dr2dr is that of notifications, and these are very customizable as to how they work. So let's move to the Boardwalk Clinic. We'll just go to the settings information here, and these notifications are actually set up to be weekly email right now, but those are customizable. We could have never or no notifications, an instant notification, daily or weekly, and we can also have email, SMS, text messaging, or both. So all that information can be customized on how they want to do. In general, physicians usually like to do a weekly or a no notification for the clinic. The staff deal with that, so it's not usually something that they're too concerned about. But a weekly email just simply gives a summary, maybe a quick reminder to check the clinic mailbox once a week and see what's been going on. On Dr. Clark Bonner's personal mailbox, however, if we click the settings button, he can actually customize those, and he's got this set to be a daily email. So in this case, he's getting an email once a day to remind him to log into the system and check to see any new messages. But again, that's fully customizable. It could be an instant email or an instant SMS message, whichever he wants, and that information can be set up. Now, the real power in the system actually comes into play with the notifications per message. So in this case, for example, if we're very concerned about Harry Smith, there's some sort of critical condition that's going on, and we need to know exactly what's happening as soon as anybody replies, we can actually configure that notification on this conversation only to be an instant SMS text message, so that we'll get a text message to our phone as soon as anything happens in this conversation. And in that case, when that text message does appear, it's a standard text message. It's very generic. It says you have a new message waiting in the conversation webinar demo, and with a link to that. So then you can tap on that on your phone. It'll open up in your mobile browser, and the dr2dr site does work across phones and tablet devices. It's a responsive design, and you can log in and view that conversation, reply back, all that kind of stuff. So one other feature we could talk about is that of the address book, and we'll just click on the icon here at the top. Now this is the same address book that appears when you start a new conversation. It's just in a little bit more of an easier format to read. And we can click on the physicians, we can see their specialties, all that kind of stuff. We can start a conversation right from here, and there is all listings with it as well. So if we're looking for a specific user, doctor, clinic, etc., all that information is in here, and we can click on them and see that. One of the beauties with the address book is that you can also look by specialty. So if we're looking for a knee, for example, or somebody who deals with knees, we can type that in, and we get that list. And here's Joel McGovern, and his practice interest is knee and hip, so we know that he's somebody that deals with that. Likewise, if there's something that they do not do, that'll appear here as well, which is often just as important. We can just simply start a conversation from there. It takes us back into the conversation view, and Joel McGovern's automatically populated into that to box. And one last thing before handing it over again is that of the profile settings. If we click on the physician's name here in the corner and go down to settings, we actually can edit the profile and all this information that is associated with him. So we have his contact phone number, any languages, any specialties. These are just populated from the standard specialty list, so those can be added in. Address, special interests, practice interests, and anything that the doctor does not do. So thank you very much for watching the demo, and that's all for now.
Okay, thanks, Brandon. So I just want to talk a bit about cost. We would like it to be free, but obviously it can't be. So what we've done is our best to hold the cost down and make this useful for physicians and also cost effective. It's a subscription-based model. You can bill it on a monthly or yearly basis. The charges go through a credit card. And one of the nice things about this is that it's an all-inclusive per physician price. So the cost is $34.99 a month. That's less than the cost of a Globe and Mail subscription if you want the paper. The nice thing about that is it covers off not only your account, but it actually covers off the staff that are underneath you in the clinic. So if you have 5 admin staff in the clinic, those 5 admin staff are covered off in that $34.99 cost per month. It also includes unlimited messaging, unlimited access to the system. You can get out from anywhere. You can sit on the other side of the world and get access to it, and unlimited upgrades to the system, which are things that we're going to be working on over the next little while. I do want to mention, though, that if you have people in your office that are employed by a PCN, by AHS, or Faculty of Medicine, since they're not directly employed by you, they have a different charge, $10 per user per month, and they're not included in your all-inclusive per physician price. Talking about the e-consult codes one more time as a cost offset, here are the 2 codes. So on the requesting physician side, the person that's actually requesting an e-consultation, the charge or the user fee is $15.88. So if 2 of these are done a month, you've covered off the cost of doctor-to-doctor. On the receiving physician side, so the person responding to the e-consultation request, the fee is $75.51. So basically that covers off the cost of doctor-to-doctor for 2 months. And just a reminder again that you can only bill those codes if you're using a secure messaging solution like doctor-to-doctor. So where are we on the timelines? Well, currently it's in February, March, and we're at the point where we're actually getting pilots up and running on the system. So we're pretty excited about this. We have several pilots getting underway, and we'll probably be looking at a few more. That's going to ramp up into our limited production rollout. So this is where we're going to bring on several hundred more individuals to test out the system, make sure everything's working before we go to full rollout, which is going to happen on July. So in full rollout in July, we're going to roll this out across the province. It'll be a large marketing campaign. Our goal is to have a 3-month free trial period, get everybody up on the system if possible, get them using it, and we're going to provide assistance with your PIA during that period of time as well. So the PIA amendment that has to be done for doctor-to-doctor, one of the nice things we're going to do for you is we're also going to address the OIPC breach reporting requirements which came out last year. So how can you get involved? Well, the first thing you can do is you can help us get word to other members that it's time to axe the fax. It's time to move away from the fax machine and phone, time to get on a modern email communication system and start using secure messaging on a day-to-day basis. The second thing you can do is you can actually follow up with us for more information. We're happy to do WebEx demos. We're happy to talk to you on the phone or actually come in person if we can and provide more information on doctor-to-doctor. The third thing you can do is get involved in a pilot. So as we said, we're currently in the point where we're looking for pilot situations. If we can get into your clinic or other clinics that you know, demonstrate the value of doctor-to-doctor, it'd be very much appreciated. And finally, joining the limited production rollout, which is happening in April, send us a message. We're happy to get you up and involved. And when we roll out, we're hoping that everybody's going to actually use the system. Okay, so that concludes our presentation today. If you have any questions, please feel free to contact us. You can reach us at brandon@microquest.ca or Michael McDermott at albertadoctors.org, or you can send us an email to securemessaging@albertadoctors.org. You're also welcome to check our websites. You can check dr2dr.ca, the main website for the system, or you can check albertadoctors.org. We have secure messaging information up there as well. Thank you very much.